Hi everyone, I am Rhea Berong, a second-year student of Southwestern University. And this video, I will demonstrating a female catheterization. First, we have the assessment. First thing that we need to assess is her overall conditions, which includes her consciousness and her ability to participate in the procedure. Next is to determine when was the last time that the patient voided or urinated, then we percuss the bladder for distension and fullness. Next is to assess the external female genitalia for redness or any skin breakdown, the odor, and even the discomfort of the patient. Next is to assess for any kind of discharge and drainage and tenderness for any localized area. Take note, it is our responsibility to always verify the physician order before we conduct any procedure. Next is prepare all the materials needed. As far as you can see, I don't have here a real patient, but still I find a creative way on how to perform a female catheterization. After preparing all the materials needed, identify the patient, explain the procedure, and ask for iodine allergies. Good day, ma'am. What is your name? Okay, ma'am Koino, I will perform a female catheterization. During this procedure, it might be painful, but it is tolerable. Next is ensure the privacy of the patient by closing the door or curtains and exposing only the female genitalia. Next is position the patient correctly. Assess the dorsal recumbent position, the knees flexed, feet should be flat on the bed for AC to access the urethral meatus. And to formally start to our procedure, let's do a hand hygiene first. Since we are now done the hand washing, let's start to our procedure. First, open the sterile catheterization kit on a clean bedside table. So basically, this side over here is the sterile field. And while wearing a gloves, make sure to maintain sterility. After wearing a gloves, we are now sterile. Since we are now sterile, make sure not to touch anything. Next thing we do is drip the patient and slide the drip under the patient's buttocks. Pick fenestrated drape and place over perineum with the hole over the labia. Here. After placing the waterproof pad and the fenestrated drip, we will now proceed to cleansing the meatus and a cotton balls using the first steps. So with the non-dominant hand, we will use to spread the labia, and the one sterile hand we will use to pick cotton balls by using the forceps. So let's spread the labia. In cleansing the meatus, it is from farthest to nearest with downward stroke. First, clean the labia farthest from me. Top to bottom, then take note, do not retrace. Next, repeat the procedure to clean the labia closest to me. Top to bottom. Repeat the procedure a third time to cleanse the area between the two labia. Top to bottom. Then discard the cotton balls. Allow the antiseptic to dry. So, After cleansing the meatus, we will now proceed to inserting the catheter. Now, I will start holding a catheter as if holding a pen. Ideally, the tip of the catheter should be added a lubricant. Since I don't have one, let's just assume that I already did. So, with a non-dominant hand, let's use to spread a labia to expose a urethra and to properly insert a catheter in the urethra. So, while inserting, ask the patient to take slow, deep breaths until the initial discomfort has passed. So, ma'am, can we exhale po? And we're going to insert this at the urethra and you will be feeling resistance, and that's okay, ma'am. And we will just continually insert the patients to inhale and exhale. Okay, ma'am, exhale po. Yes, like that po. So, after inserting around with the 4 inches and you observe a urine flow, and that's the time you will advance the catheter around 1 to 2 inches to properly anchor the balloon. After advancing around 1 to 2 inches, I will now be inflating the balloon with my sterile hand. And I will going to inflate that. Yes, like that. And you will feel a resistance. If there's a resistance and the catheter does not move, it means that the balloon is already anchored at the bladder. And now that I have successfully inserted a catheter inside a urinary bladder and properly anchored, I will now place the collection bag just below the hip to prevent ascending infection. And make sure to take the tube at the inner thigh to prevent tension and pressure in the urethra. Now, let's place at the inner thigh and place the collection bag below the hips at the bed spring. So, that's it. So, before taking off the gloves, I will remove first the drapes, pads, and the sheets. After proper disposal, we will now assess the patient to a comfortable position. So, I will remove now my gloves. So, after the proper disposal, we will now assess the patient to a comfortable position. And after that, perform a hand hygiene again. So, that's all. Bye!